Good evening. This is Dr. John Bennett, televising from Miami. Tonight we have another in the series of Parkinsonism education hangouts. We have Dr. Abdul Rana, a neurologist from Toronto and a well-known Parkinsonism educator. Tonight, Dr. Rana is going to talk about caregiving in Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett. How are you tonight?
Very good, very good. Okay, we'll start off right off with a question.
Sure.
What is the impact of Parkinson's on a caregiver's life?
Parkinson's disease is a very debilitating condition and has effect not only on the patient but also on the family and caregiver, and it causes the caregiver strain and depression. And this strain and depression is not only in the beginning or late stages, but it's present throughout the course of the disease. And as the disease progresses, this strain on the family as well as the caregiver, it does increase with time. This not only causes a physical strain, but also a mental and emotional strain. And also in case of patients, it does result in a long-term care placement and also causes a lot of economic burden on the society. Reducing this strain of the caregiver may result in many social and economic ramifications. And traditionally, because the treatment of Parkinson's disease has been directed towards motor symptoms in most cases, so we should look at the contribution of non-motor symptoms in the caregiver strain so that we can raise more awareness about the non-motor symptoms in the caregivers as well as in all members of healthcare team, so that these problems could be addressed, and as a result, the caregiver depression and strain could lessen. The non-motor symptoms have a greater impact on a patient's quality of life as well as on the quality of life of the caregiver. Even the mild problems such as mild cognitive changes or trouble with the delayed recall, they can even predict the caregiver's depression. Overall, the non-motor symptoms, they seem to be a stronger predictor of the caregiver depression, and they have a lot of negative impact on the families as compared to the motor symptoms. And being a caregiver to a Parkinson's disease patient, it could be quite challenging, and sometimes it could be overwhelming. Because the caregiver, they have to change their own life to accommodate the life of a person or the necessities of a person who is seeking their help. And the people with Parkinson's disease, of course, they want to live as independent as possible. So the caregiver has to make a lot of changes in their own routine and in their own lifestyle, and they may have to do some sacrifices. And also this needs a lot of encouragement and strength on the part of the caregiver as well. As the disease progresses, the responsibilities and the role of the caregiver, it does increase with time. And as patient becomes more and more dependent and less mobile, and their condition becomes worse, so they are in need of more help of the caregiver. So not only the emotional support is needed, but also in the late stages of the disease, they need the physical support to manage the complications of Parkinson's disease and the impact on the life of the patient.
Very good. How should a caregiver help?
The caregiver plays a very important role in the care of patient with Parkinson's. So this is like a team. Boss is the patient, and then caregiver and the physician with the other healthcare providers such as a physiotherapist if needed, occupational therapist, and other members of the team. So these three components, the patient, the caregiver, and the healthcare team, they are the integral part of this team, and the caregiver plays a very important role. They not only provide emotional support, but also they provide a physical support as the disease progresses. They also serve as a bridge between the patient and the healthcare team, and they are the only person who watches the patient on constant basis, who are with them, and they also note the impact of medications and the condition, if it is improving or if it is deteriorating. So the caregiver has a very close observation of the patient, because physician or other members of the healthcare team, they only see patient once every few months and maybe for an hour or so. So they would get a real picture of the condition of the patient only by talking to the caregiver. Whatever feedback the caregiver and the patient provide, so the physician and the healthcare members, the healthcare team members will make decisions accordingly. And in late stages of Parkinson's disease, the patient, because they develop cognitive dysfunction, they may not be able to provide much of the history or much of the insight of their own condition, and it's more caregiver who provides a parallel history. So the caregiver should keep the open lines of communication to every member of the healthcare team. So what they should do, they should write questions. So in between, if they have any question or if they note any change in the behavior of the patient, in the mobility of the patient, or if they note any side effect, or if they see any impact of medication improvement or deterioration in any way. And so they should make note of these things, and when they come to the appointment with the patient, they should attend with the patient, and they should ask these questions, and they may note down the answers because they can refer them back when they go back. So they serve as a very important tool of monitoring and overseeing patients' daily care and patients' progress and patients' improvement. And also, if there are any Parkinson education clubs in their environment, in their close by, in their neighborhood, or in the same city, the caregiver should try to attend those Parkinson's education clubs of World Parkinson's Program, because these Parkinson's education clubs, they provide a platform for the caregivers to share their experience and observations with the other caregivers as well as patients. So they can learn a lot of things. They can learn many strategies which other caregivers use to deal with the complications of Parkinson's disease in case of the patients. So they can share their experience with each other, and that also builds a relation with other people who are going through the same change, and they are also serving the same role. So that becomes very important. In addition, they also provide an important role in the daily intake of medications, because the treatment of patients depend upon how regularly, how compliantly they take their medications, if they take their medications on time every time, and they take their medication as they are instructed and as they were advised by their physician. So that becomes very important. And the patient may not remember all the instructions when they are with the physician. So the caregiver has to play a very important role, not only reminding the patient about the medications in the beginning of course of disease, but also as the disease progresses, they can take the charge of administering the medications to the patients to make sure that no medication is missed and the medications are given as instructed. For example, if the physician tells patients to take medications with food, then the caregiver must make sure that patients have a meal with the medications, or if it is not a meal time, they should have a snack, and if they are advised to drink ample amount of fluids with it, so the caregiver can make sure that the patient drinks the fluid, because compliance is very important. The patient's condition would only improve if they follow the instruction and if they are compliant with the advice given by their physician. And to make sure this, the caregiver has a primary role. And as the disease progresses, the involvement of caregiver increases, not only in administering medication, but also but also observing the behavior of the patient. If the patient becomes depressed or they note any other changes in their condition, they should be very particular and they should contact their healthcare team whenever necessary.
Is there anything the caretaker should watch specially? Is there anything special that they should watch out for?
There are many things which a caregiver can watch. First of all, they can watch the symptoms of patients, the motor symptoms, of course, the bradycardia, slowness of movements, tremor, their mobility, and patients' sleep, their social interaction with other people, and the effect of the medications. And also they should watch for any side effects or any sudden changes in the deterioration like the sudden deterioration in the condition of the patient. And also behaviors. If patient has started to withdraw socially or they have started becoming anxious, so the caregiver should be very careful and they should be compassionate with these patients. They should try to involve them more in the social activities, and they should try to engage them in exercise and other tasks such as mental stimulation exercises. So that helps patients, that occupies them, and that gives them a cognitive challenge. They are not depressed or isolated. So the caregiver also should note the cognitive and memory difficulties the patients have, or if patients have hallucinations, especially when patients have visual hallucinations. And sometimes they could be frightening. If the visual hallucinations are frightening, then the caregiver should discuss with the physician or other members of healthcare team, such as a psychiatrist, and then they should act accordingly, whatever the advice is given. Also, during this phase of illness, they should be supportive to the patients. If the hallucinations are not, they are not frightening, and so still the caregiver should not endorse the hallucination. They should not agree with the patient, or neither they should confront the patient. They should not argue with the patient, because argumenting with the patient will increase the agitation. And in case of delusions, same thing. They should not neither agree with them, nor they should enforce them. They should try to ignore them. And also, sometimes explaining very gently could help. In addition, if patients are disoriented, then a frequent orientation, putting a clock in the room, keeping the house light, the curtains open, and also light, having the enough light in the house is very important. And if patient wakes up at nighttime, the caregiver has to be very vigilant so that they don't fall. So the hallway should be properly lit, and also there should be ample light in the washroom. In the late stages of Parkinson's disease, it's advised that the caregiver, if possible, they should try to wake up with the patient, and they should try to accompany them to the washroom so that falls are avoided, because falls could have very serious consequences. And if the caregiver is the spouse of the patient, it even becomes more difficult because there are certain challenges which they have to meet. For example, if patient has emotional issues, they have sexual dysfunction, understanding these problems and then reassuring patients is very important. Suppose if patient has drooling and they want to join a meal with them, so a proper care has to be provided to the patients so that they are neither isolated nor they are looked down upon by other people. And also, in such situations, a frank discussion with the patient in a very friendly environment is very helpful. Nighttime safety, as well as those patients who have urinary incontinence. So because of the smell of the urine, it could be difficult. Therefore, the frequent changing of the undergarments is very important. So all these issues, they revolve not only around the patient, but also the life and routine of caregiver is also quite occupied with all these issues.
Okay, is there how should a caregiver better their life? How can a caregiver better their life?
the caregivers are mostly occupied improving the life of patients, and their dedication, their commitment with the caregiver, it takes a lot of their time, a lot of their energy, and they have to provide a lot of emotional support and moral support to the patient. So what ends up happening, they sometimes ignore themselves. So their own health, their own physical and emotional well-being starts being affected. So which is not good either. So the caregiver should try to reduce their own burden. They should try to deal with their emotions, because sometimes they may have emotions of guilt and frustration. They may feel a bit guilty about the patient's condition, although it's not their fault. They could try to discuss the ways with the patient or other immediate family members how the stress can be reduced. Also, the physical assistance, if they can hire a short-time caregiver, or if other family members can take turns, that is very helpful. The caregiver, the primary caregiver, should try to take breaks for themselves, no matter how much a person is dedicated, but they do need time for themselves, and this does restore them in a better health. So sometimes accepting support from other members of the family or friends is very helpful. The caregiver should also try to distribute some of the tasks to the people who are willing to help, and if they feel down or low, they should try to discuss with someone they trust. They should not let themselves down or let themselves go depressed, because then what happens, eventually the care of the patient would also be affected, not only the caregiver himself or herself. They should also keep their own physical health in a good condition. The caregiver should exercise regularly. Caregivers should see their own family physicians regularly, and if they need help of a psychiatrist to deal with the depression or frustration or feeling of guilt, the family physician should refer them to the proper authorities or psychiatrists, because caregivers are usually, if their spouse, they are also elderly in the same age group, so they should also be careful to take their own medication sometime, their own health issues. They should try to take close care of them, and also especially when the disease progresses, it becomes more and more challenging. So the caregiver should try to take help from other resources. Most of the communities have some resources, such as community care access programs are available. Sometimes adult daycare centers are available. In these adult daycare centers, a patient can go for several hours. They can go from like 9 or 10 in the morning, and they can be there till 2 or 4. They have many patients with different medical conditions, and they have a team leader, so they have time there to socialize. They can play cards, or sometimes they take them for a tour of the city or any other sites. So these things are quite helpful. And sometimes these could be several days a week, and usually they have a very low cost, because sometimes government has funding for them. So these adult daycare centers, I find them very helpful in my patients. Some of my patients, when they start attending these adult daycare centers, they give me feedback that they feel so good, and also they try to maintain their condition when they come home. Also, there are some short-term rehabilitation programs or respite centers, and sometimes making meals may not be easy all the time for the patient. So Meals on Wheels can be achieved or obtained. And there are some other agencies which provide personal support workers. So if financial resources allow, they could be hired for a short term at least when the primary caregiver takes a break. So the utilization of these resources time to time becomes very important, and it gives a caregiver a time to take care of themselves, so that they keep themselves in good health.
Very good. Okay, I think that pretty well covers caregiving and Parkinsonism. Is there anything else you want to add before we close on this session?
I see sometimes the caregivers, if their spouses, then the patient may have patients may have delusion. Some patients in advanced stages, they have psychosis, they may have delusions that the caregiver is involved with someone, they have an affair with someone else, or they are poisoning them, or they are not giving them proper care. So that becomes very challenging because the caregiver is dedicating their life for the patient, and then they have these type of thinking by the patient, which makes them feel so down. So I always advise them to be patient with the patient, and to discuss with the patients in a very frank manner. Also, to talk to their physician, and if they need to see a psychiatrist or any other physician, that becomes very important. The life of patient can only be improved if the caregiver is in a good health. So in the whole team of healthcare team of Parkinson's disease patient, the caregiver has a primary role. And sometimes I talk to the patient, to the caregivers, to the extent that you can find another neurologist who may be much better than me or anyone else. And there are many people who specialize in Parkinson's. But finding another caregiver, especially if caregiver is a spouse or a child, may not be easy, because a hired caregiver may not provide as good care as immediate family member. So I tell them that you are the most important person in the whole circle of the care of this patient. So you have to make sure that you stay in good health. If the physician is not there, you can definitely go to another physician. So they will provide same level of care or even good. But if the caregiver is missing from this loop, then the life of patient would be very difficult, and their condition would be getting weak. So I can't emphasize more than this, that the caregivers have a primary role, and they have to keep themselves in a very good health. It is a challenging a journey which they have to do with the patient, and they have to be as patient as the patient himself or herself.
Very good. Well, an analogy to that is on the planes. I don't know if you've been on planes, Doc, where they say to you, if there's a problem, first take care of yourself with the oxygen,
right,
so that you can take care of anyone else that's injured or whatever. So
that's true. The same concept applies here, I think.
Yep, same concept with Parkinsonism and caregivers. Okay, thank you very much. This show will be on Parkinsonism TV. And stay tuned for our next Parkinsonism Hangout educational video. Thank you, Dr. Rana.
Thank you, Dr. Bennett. See you later.
Okay.